welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what all we have for you from the world of medicine. The benefits of breastfeeding in babies and their effects on boosting their immunity. A cohort study results published in Annals of Allergy, Asthma and Immunology showed that longer the duration of exclusive breastfeeding have a protective association with childhood asthma. Postnatal exposures, including breastfeeding, may influence the asthma development. Morbidity of childhood asthma accounts for up to 50% of emergency visits, and although much progress has been made in terms to control this condition, there is still no cure for asthma and very little is known about how to prevent it. Over the years, it has become evident that factors in early life, they play an important role in the child's susceptibility to developing asthma. The study that I'm talking about included close to 2021 mother-child diets, and it aimed to investigate the association between breastfeeding duration and childhood asthma. The authors developed questionnaires asking mothers about the durations of their breastfeeding period. It was found that 16% of the children had current wheeze, 12% developed asthma, and 9% had strict current asthma. There found to be a duration-dependent protective association between the breastfeeding period and the childhood asthma outcomes. The researchers hence concluded that their findings did provide evidence of protective associations between the two, that is, breastfeeding duration and the duration of developing childhood asthma. Which one of the colonoscopy procedure is considered better? Either the computer-assisted colonoscopy or the traditional colonoscopy procedure. Colonoscopy is performed with computer-aided detection or an artificial intelligence, so an increase in the overall rate of detection of adenoma or cancerous or precancerous polyps by 27% in average risk patients. This is in accordance to a new data that was presented at the Digestive Disease Week annual meeting. The results of the prospective randomized multi-center study that was published online in the journal Gastroenterology found that when artificial intelligence was used during a screening procedure, the adenoma per colonoscopy rate increased significantly by 22% from 0.82 to 1.05. The research further suggested that artificial intelligence can be an efficient tool for gastroenterologists and endoscopists to incorporate into their procedures to reduce the number of polyps missed and left behind in the colon, which of many can be precancerous. The study used 22 skilled board-certified gastroenterologists who performed colonoscopy on 1,440 patients who were randomized to receive either a standard procedure or colonoscopy using a computer-aided detection software. All the patients included in the study were over the age of 40 years, and a total of 677 patients were randomized to the standard arm and 682 in the computer-aided group. The number of polyps found using the computer-aided colonoscope was 1.05 compared to 0.82, and there was no decrease in the true histology rate, indicating the polyps of concern were all removed. The researchers concluded that the findings did add on to the growing amount of literature that shows using a computer-aided technology during an endoscopy procedure can improve the quality of examinations performed and also improve the outcomes for patients. How effective is the diabetes drug against breast cancer in particular? According to new findings, a widely used and inexpensive type 2 diabetes drug once hoped to hold enormous promise in treating breast cancer did not prevent or stop the spread of the most common form of the disease. The randomized double-blinded trial enrolled patients who were treated with 2 pills a day of either the placebo or the diabetes drug metformin. Overall, the researchers did find that the addition of metformin to the standard breast cancer treatment did not improve the outcomes in the 2 most common types of breast cancer, that was the hormone receptive, either positive or negative. The findings were published in the Journal of the American Medical Association. While metformin was found not to be effective in treating the most common forms of breast cancer, the trial did find a potentially important result for individuals with a less common but an aggressive form of the disease, which was called the HER2 positive breast cancer. For the subtype of breast cancer, the researchers found that there was evidence that use of metformin for 5 years might lead to a reduction in deaths. The HER2 positive cancer makes up about 20% of all the breast cancers. Metformin is not beneficial for use in most of the common breast cancer cases, but in the cases of HER2 positive cases, These findings suggest that it definitely can be beneficial. The effectiveness of artificial intelligence in diagnosing lung cancer in particular. As per a new study published in the journal Radiology, an artificial intelligence tool helps doctor predict the cancer risk in lung nodules seen on a CT scan. Pulmonary nodules appear as small spots on the lungs on the chest imaging, and they have become a much more common finding as a CT has gained favor over the X-rays for chest imaging. In the study, 6 radiologists and pulmonologists made estimates of malignancy risks for nodules using a CT imaging data alone. They also made management recommendations such as the CT surveillance or a diagnostic procedure for each case without and with the artificial intelligence tool. A total of 300 chest CTs of indeterminate pulmonary nodules were used in the study, and the researchers defined these nodules, and they also analysis showed that the use of the AI tool improved the estimation of nodule detection, thereby raising the malignancy risk on a chest CT. Malignant or benign lesions were usually judged with a reasonable level of accuracy based on the imaging itself, but when you combine their clinical interpretation with the artificial intelligence algorithm, the accuracy level shoots up significantly. The level of improvement did suggest that this tool has the potential to change how we judge cancer and hopefully improve how patients can be managed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.